um, where the abuser would always start by encouraging the young women to not have sex. That's how they started the grooming process, was they just wanted to help these young women have good boundaries, and so they would educate them on this stuff, and in the process would identify the kids that maybe had poor boundaries in that area, which is just awful. The beginning stages of the abuse, testing the barriers, eroding resistance, those discussions. The playful or accidental touch is something that comes into play in a sports context a lot. It's just blurring that physical touch boundary, right? Nothing inappropriate to start with, but it becomes a pattern where you normalize touch, right? Accidental nudity, creating a culture where nudity or partial nudity is acceptable. And you might hear that and go, well, come on, that doesn't happen. Well, a couple years ago, we had the bright idea to have training jerseys for tryouts. And I don't know, some of you probably remember John shaking his head. The day that the girls came out for tryouts, we're handing them jerseys, and they're whipping their other shirt off with their sports bra on to put the training jersey on, right there next to 10-year-old boys, right? And we go, well, I mean, they had that sports bra on, but okay, it's pushing that boundary. Would we do that at Walmart? Right? Well, it's a soccer field, you know. There have been multiple times where I've pulled up to the soccer field at a tournament, and there's a child changing. You know, they're not naked, right? But it's pushing that boundary that it's acceptable to live that way, right? Cases where coaches encourage female players on a hot day that it was okay, as long as you had a sports bra on, it's okay to take your shirt off. It's really hot. I don't want you guys to overheat. Small boundary violations lead to big problems. Grooming by age, and again, I'll try to get through this fairly quickly. Younger children are groomed by the use of secrets. They're made to feel special, that this adult cares for me in a way that other adults don't care for me. Older children are groomed, 10 to 13 age. They're very kind of tactile at that age, very physical. You know, they like to horseplay and things like that. And so that kind of touch and accidental nudity and sports massage is something that we need to be very mindful of. Teenagers, and this is a huge one, and we'll get into some rules here in a little bit, but teenagers are frequently groomed by very personal relationships that can happen via social media, text message, these kinds of things, places where the adults don't see it, it's not happening out in public. And these can seem harmless at first, it's good that my coach is taking an interest in my child, but again, slowly turning up the temperature on the water. And before we know it, they're exchanging photos and having more personal conversations and taking children on trips and things that, in hindsight, you look at it and go, how could you do that? Who would allow that? Well, we allow it because that person grooms us as much as they groom the child. So what are some of the grooming behaviors? It's gift giving, it's special privileges, it's time alone, it's horseplay, it's being more like a peer. That's another sign, especially with the older kids, the teenagers, acting a little too much like one of the kids. And then lastly, a big one, especially within our context and any sort of large system, is breaking rules together, right? So it's supposed to be a rule that coach never takes a child anywhere, but we're going to break this rule, so shh, don't tell anyone, it'll just be our secret. I know you're really thirsty and your mom's not here, so I'm going to run you down to KJ's and get you a Gatorade, right? And that's just testing that boundary. Will the child go along with that? Well, now we have a secret together that we could both get in trouble if we tell, so we can't tell. And that's the beginning of that don't tell process. how do they keep the victims quiet? Guilt and shame is one that's easy to see. Secrecy, you promise not to tell, so you don't want to break the promise. You don't want to be a liar, so you'll keep quiet. And sometimes even outright threats. Not usually. The threats are more implied, but there are threats that are made that I'll hurt you, you'll hurt the team, I'll tell everyone what you did. And to a child, they're not mature enough, they're not psychologically developed enough to go, wait a minute, what I did? I didn't do anything. You're the adult here. You did this, not me. They don't have that. That doesn't make sense to them. Why does coaching appeal to abusers? This is an important thing. A lot of the expected behavior that we have for our coaches, it's the same thing that we would see as grooming behavior. Right? But there are differences. There are subtle differences in some points, and they grow to be very apparent differences. Abusers love to coach because they're in that position of being the authority, right? They're training children to trust them. Trust me on the pitch. If I put you in this position, you need to play that role. Trust me, I know what I'm doing. That's not wrong or bad, but that is very similar to other grooming behaviors. Coaches should not be questioned, and coaches are surrounded by supporters. This is something we have in our club, and I think less so now because we have more organization, but especially in the past, we had coaches that became very popular with certain parents, right? This group of parents really likes this coach. This group of parents really likes this coach. And when that happens, they stop looking at that coach as someone they should be suspicious of or wary of. So what can we do? Well, the number one thing we can do is cultivate a culture within our club where abusers are uncomfortable. And to do that, we have to be, very comfortable calling grooming behaviors, right? We need to become comfortable with the fact that you may not be guilty of sexual abuse, but you are guilty of being an idiot, and we don't have idiots here, right? So just because you did this thing, no, that doesn't make you an abuser. It does make you an idiot. So we're not going to do that. And we need to be comfortable saying that. We should be a place where these behaviors are challenged. And it takes a lot of maturity and on both sides for a club to set boundaries and expectations, and then our volunteers or even our paid staff to respect those boundaries and to understand that those are there not because this particular person is a bad person, but because we don't want to be a club where we have this culture where abuse could occur without being challenged. So what can we do? We can do what we're doing right now, right? We can have talks about it. We can make it something that people are aware of, and we take some of the discomfort out of the topic that between coaches, between administrators, between parents and volunteers, that it's something we can talk about. We need to encourage clear channels of reporting. We have coaches, we have team managers, we have volunteers, we have board members. There are lots of people to talk to, right? And we need to encourage that parents, if you have a concern, here are the people you can talk to. If you have a concern about a coach, you can talk to the board. If you have a concern about the board member, you can talk to your team manager and your coach. We have to set it up to where people know who to go to. That is a small barrier, it seems like at the beginning, but if you're in that moment, if you're that parent and you don't know who to talk to, and you know that, well, if I say something, this could really blow up in my face, right? Everybody else likes this person, but I have some concerns. If I bring it up and I don't bring it up to the right person, well, I'm going to be the outcast, right? I'm going to hurt my child who enjoys this sport. And we need to remove people that display grooming behaviors. We haven't had that problem, I don't think, in the last year or so, but we have to take strong stands at times to say, whether it's a coach or another volunteer, this is against our policy. You're no longer welcome here. Well, I didn't do anything wrong. Again, you may not be guilty of child abuse, but you're guilty of being an idiot, and we don't have idiots, right? Lastly, and I'll get through these fairly quickly, but what can we do? Well, we can have some rules. We need to have rules. The problem with these kind of topics is that they're often so general and so kind of, it's like an umbrella, and we go, yeah, okay, there's this thing called sexual abuse, but now that I'm aware of it, and I don't do anything else. But we need some rules. So here are some rules. No coach is allowed to be alone with any player who is not their child. In unavoidable instances, it must be reported to the team manager at the time of the incident. So, coaches, Brandon, you guys need to be reviewing this, right? Coaches should not be alone with a child that's not theirs. And what's an unavoidable circumstance, right? I, at least once, maybe more, have been guilty of being the last parent to pick the kid up from practice, okay? That's an unavoidable circumstance. It's as simple as a text message to the team manager. Hey, it's 6:03, all the other kids have left. I've got Johnny with me. We're hanging out at the fields waiting for mom to come in. There's just that little bit of accountability. And if you follow that step, right, it makes it much harder for allegations to be made, right? It's when we have secrets that's a part of that grooming behavior, right? So no coaches should be allowed to be there alone with a child. The next rule, coaches are not to hug any player at any time in a manner that includes frontal contact, right? Dean, come up here. All right, we're gonna make Dean uncomfortable. Come on, Dean. Did I do this to you last time? I think so. Why do I pick on Dean? All right, so this is inappropriate, right? Inappropriate. Yeah, right here. Yeah, that's inappropriate. We don't need to hug players like that. You know what is appropriate? This right here. That's okay, but I wouldn't even do that. You know what's even better? That right there. That's all you need. That's good. That's all that child needs. That child doesn't need a hug from you. If that child needs a hug, they have other people in their life for that, right? High fives, fist bumps, they work just fine, okay? Now, here's the problem, and some coaches have probably been in this situation. I've been in this situation, especially with the little kids. They don't know that. They don't know that. They're huggers, you know. They'll just come up and hug on you, right? Well, do your best and make it obvious that you're not violating a boundary there, right? And, by the way, even little kids love rules, so you can even make a rule with the kids. Hey, every time you come off the field, I need a fist bump, right? And then that way, they're conditioned to come off the field, give you a fist bump, and not give you a hug, right? You didn't even have to tell them, don't hug me. You just introduced another path for that. Another rule, coaches are not permitted to room with players other than their children or those that they have legal custody over, okay? Now, there are a few times where there have been exceptions that needed to be made because maybe it was dad and son and nephew, right? That I'm not the legal guardian of this child, but it is my nephew, right? And those things can be handled on a case-by-case basis. Believe it or not, there are lots of places and lots of times where parents will send their kids to stay in a hotel room with their coach for 3 days for a week for a tournament. That's not okay. We're not going to do that. Next, coaches are not to provide massage or stretching assistance by physical contact for any player. Now, this is another one where it's like, well, but what if they're cramping up on the field, right? Well, usually with the older players, you can have another player do that. I think that's usually better if they're cramping up. We have increased role with McLeod in terms of providing on-site staff for tournaments and things like that, and that I think will continue to grow. But as a coach, you just shouldn't be putting your hands on the kids, right? Especially in cases where there's a leg, right, hamstring, quad, and we're touching that gets a little uncomfortable. Another rule, coaches are not permitted to privately call, text message, or otherwise contact a player. This includes social media. Communication must come through the team manager, a parent, or some type of group, not group chat, but Team Snap and some other apps where you can send something out and everyone gets the same message. This is an area where people it's hard, right? The world we live in now just accepts that adults are going to text 13-year-olds. I don't know why, but happens all the time. This is hard, and it probably involves changing behavior. But I think as a club, we, again, need to be comfortable saying, that's not okay here, that's not how we do it. If that is the reason someone doesn't want to coach or volunteer within our club, I'm very happy for them to go, right? That is a small, small thing. To not be texting or be, Facebook messaging players. That is a tiny thing. The other benefit of this is it increases the communication channels, right? If we're going through the team manager, if we're going through these more organized things, it increases communication and helps in lots of other areas too when it comes to we had to change practice time or whatnot. So there's some benefits of that. Lastly, or last two, I guess, coaches are not permitted to discuss sex or sexual topics with any player. This includes jokes, body parts, or topics that could be illicit or arousing to a child. Any player that expresses a need or question or concern, we can point them in the right direction, right? You're their coach, you're their volunteer, you're the person helping them when they play soccer. You are not their sexual education professional, right? It's not your role. That might sound like, well, okay, that's easy to avoid. But again, by having the rule and by saying that that's something we can enforce, it's something we can take action on at some point if we see grooming behavior occurring. And the last rule, and I've kind of alluded to it a few times, is just don't be an idiot. Right? You do not have to be guilty of sexual abuse to be removed. Just being guilty of being an idiot is enough because it's just not something that as an organization we should tolerate. So I want to close on that. I know that's kind of a very heavy topic and it's a little heavy-handed at times, but it's so important that we have an opportunity as a club to play a role in the lives of these kids that can be wonderful. I have 2 kids that have played. My oldest has benefited so much. If he were here right now, he would know half of the adults in this room and would consider them a positive influence on their life, right? I mean, all the way down the line. It's a great thing that we're doing. We need to protect it. Right? So this talk is not so much about trying to point fingers at people and see if anyone's doing anything wrong. It's about a group of people coming together and saying, you know what, yeah, we need to put a fence up. We need to make sure that that kind of stuff can't happen very easily here. So, thank you.
Thank you, buddy. Appreciate that information, very important. At this time, we're going to be going over concussion, heat-related injuries, sports injuries, and injury prevention. And forgive me if I mispronounced, but it's Dr. Adam Ploeg, is that correct? Ploeg. All right. Okay. Dean, we tried.
Appreciate it. That's all right. No problem. All right. Well, boy, buddy, how do you follow all that up? But hey, I'll do my best for you, and we're gonna, like Buddy said, we're just gonna change gears a little bit and see what we can do on a little bit different track. So, again, still talking about protecting our kids. okay? And how many are coaches and how many parents? I kind of like to know who my audience is. And so coaches, lots of coaches, parents. Okay, all right. Or a little bit of both. I see some of this too. All right, so quick overview. What's a concussion? We're going to talk about that because, again, while we've made a lot of strides over the last 10 to 15 years, there's still some misconceptions, misnomers out there about what a concussion really is. We'll talk a little bit about heat illness and also some common soccer injuries and some management. So looking at a concussion specifically, it's actually a brain injury. So it's not just, I bumped my head, I'm seeing stars. We always used to hear those types of things, but it's a whole lot more than that. It actually is a brain injury. It can be caused by a direct blow or an indirect blow. So, a common question that I get also, heading a soccer ball, is that bad? Maybe we don't know yet. And that's kind of the honest truth, okay? You talk about football players, the constant repetitive hits that the linemen have. Well, they don't have that one hit that may cause a concussion. What we do know is over long term, there's some research out there that is showing that the micro hits, the small hits over a period of time are shown to cause some damage. Now, is that a cause for us to go out and say, don't go head a soccer ball? We don't know that yet, so that's not what I'm saying. That's not what I'm saying, but what we do need to be aware of is that it can be caused from a multiple set of reasons. The symptoms can be either very, very rapid. Sometimes right away that little Johnny went out there and he smashed heads or caught an elbow from somebody, and right away that something's just not right with this child or this athlete. Other times, it can be very much delayed, where the athlete comes home and his mom or dad, you just say, what? My son or my daughter's just not acting quite right. Maybe they've got a headache, maybe they don't. Sometimes think that the headache is the only symptom. That's not the case either. There's a whole bunch of them, and we'll talk about some of those. It may result in some neurological changes, but the biggest thing to keep in mind is it's a functional problem. It's not a structural problem with a concussion, okay? So you send somebody over to the emergency department over at the hospital. The first thing that the ED always does is they throw them in a CT scanner. Why do they want to do that? They want to they're looking for the big problem, when 99.9% of the time it's just simply a functional problem, okay? But they're ruling out a skull fracture or a bleed on the brain, which does happen, but it's in the very, 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 very small percentage of cases. So keeping in mind, again, that a concussion is a functional problem, so it's going to affect that athlete during the school day more so than it will in their head as a structural problem, or functional problem, structural. The signs and symptoms will typically even follow a sequential order. So you can be hit in the head, you can develop that headache. Well, maybe the sensitivity to light comes later, maybe the ringing in the ears comes later, and then the headache disappears, and then you're just dealing with a certain set of signs and symptoms all the way through, while some increase and some decrease. And it may take some of these athletes a few days to get better. It may take others a few weeks or a few months to get better. There's no cookbook that says, all right, Joe has sustained a concussion, and this is how long it's going to take. That doesn't exist. If it did, I'd be sitting out on some beach right now in Florida or Hawaii or somewhere in the Caribbean, and not in rainy South Carolina today. But nonetheless, here I am. So as we look at the incidence overall, national incidence of concussions, it's pretty big. And like we said, concussions have always been around. We just didn't know, truly. Over the last 10 years, when you think about the awareness of concussions over the last 10 years, you've probably heard more of concussions in the last 10 years than you did in your previous lifetime. So 3.8 million recreational and athletic concussions each year, and that's just under age 15. When we look at locally, we see a lot of these too. So that you think, okay, nationally, yeah, it's a national problem. We have a lot of concussions here too. So this is just some local data. 2016-17 school year, when we kind of kept track of all the athletes that we found that had concussions that went to see a physician. In 16-17, we saw 91 athletes, had almost 250 office visits, and the same thing with last year. It was even more, almost 150 athletes. So that was from all sports. That wasn't just from soccer or just from football or cheerleading or softball or base. It's from all of our sports, but nonetheless, concussions are definitely very prevalent. As we look at a couple signs and symptoms of our concussions, like I mentioned, the headache, and that is probably your most common symptom to keep an eye out for. And it could be a really dull headache. It could be a really sharp, stinging headache. It could be just in one spot of their head. It could be all over. There's no rule that says a concussion only affects this part of the brain. It can affect all of it just as bad. Blurred vision, ringing in the ears, nausea and vomiting. All of these are equally as bad. So when we say the presence of one or more of these signs or symptoms indicates a possible brain injury, okay? It only takes one of those symptoms to be a diagnosed concussion. You don't have to say, Adam has to have 3 or 4 of these in order for this to be considered a concussion. It can be just one. So as we look at a team approach to figuring this out, because certainly you're only one person and you say to yourself, well, I've got 20 kids on my team, or how do I possibly keep track of everybody? Well, that's why, again, it takes everybody to kind of help each other out. Like Buddy was talking about this morning, it's not all about one person too. It's about taking this whole approach. So if you're a parent on the sideline and you see your son or your daughter or somebody else's child out there, and the coach hasn't seen it, because let's be honest, coaches are there to coach. The medical professionals, like an athletic trainer or like a physician, and maybe they're there, but maybe they're just on the sideline, or they're not even paying attention to that particular game. They're looking at this game, or they're checking out an athlete. We need everybody's eyes to be able to see what may or may not have happened on the field, or that athlete that's kind of stumbling around, that's trying to participate, but for whatever reason isn't participating or can't. We need to figure out and diagnose whether or not there's actually a concussion that's taken place or not. There is actually a state law, and this has not come out to soccer clubs, but it is something that I think I would advise that the club adopt, is if you do recognize the signs and symptoms of a concussion, that athlete needs to go to the doctor and be cleared before they return to play. At the high school level, private and public schools, that's a state law, that those athletes go see a medical provider that's trained in concussion management, that knows what a concussion is. And then in the event that they have sustained a concussion, there's a stepwise progression that athlete has to participate in before they're allowed to return to full participation. It's not just, you're good, go back and play. We want to make sure we follow a series of exercises and really make sure that athlete is prepared to play. So I'm going to just walk you through a quick flow of what to expect when an athlete may have sustained a concussion. So they'll see a physician, they'll get a symptom report, exam. Something we do in the office is a neurocognitive test. Certainly at the club level at this point, we haven't implemented any sort of baseline testing, but the good news, if your athletes are in the high school setting or the middle school setting in some cases, they'll have had those records on file with their high school. So that's certainly something that we'd be able to help out with in accessing a baseline test, a neurocognitive test such as IMPACT. If you've ever heard or been around in any of our schools that we work with at McLeod, we do a baseline neurocognitive test called IMPACT testing, and it's a matter of testing different parts of the brain before an injury occurs. That way, in the event an injury does occur, we know what normal looks like. Because after the fact, I may have sustained a concussion, but if I didn't have this beforehand, I may not know what normal looks like. So we want to use that as a tool in the toolbox. It's certainly not the be-all, end-all, but it is certainly something that helps us figure out and put the puzzle pieces back together to make sure that we're releasing that athlete to play in a manner that's as safe as possible. And like I said, I did mention the return to play protocol as well. And that's not a rocket science protocol either. It's very basic. It's day one, they might be just doing some walking. 15, 20 minutes, we just want to make sure we're increasing that blood flow. And the new research actually has started to come out over just in the last couple of months that we actually want to really get into that stage even sooner. They may have some symptoms, but we just want to increase that blood flow for 15, 20 minutes and not necessarily to provoke symptoms, but if they have a moderate headache and they're still walking or some light activity, that's maybe not bad. So there's still some new research coming out in regards to that. But then day 2, you might increase it a little bit more. Day 3, even more. Day 4 and 5 and so on. It's usually a 4 or 5 day progression before they're released to play. So it's, when you're talking about an injury that may occur on a Saturday, if they don't go see the doctor till, say, Monday or Tuesday, you may as well think about that next weekend. They may not be traveling to that next tournament, or they may not be participating on that next Saturday. And I know that's a hard pill to swallow for sometimes parents, but also the athletes as well, and also the coaches. But nonetheless, returning that athlete to participation too soon has shown to have some catastrophic consequences. So that's where we just need to make sure that we're doing our best to protect our athletes. All right. Changing gears a little bit, going to heat, and certainly we have a lot of that down here. And this was, I'll tell you, I'm from Michigan, so moving to South Carolina from Michigan, that was an adjustment. I moved in the middle of July, and I thought, boy, I interviewed in February when it was 70 degrees, and then I came down here in July, and I didn't know where I was. It was the hottest day I think I've ever experienced in my life. So when you talk about heat down here to a northerner, that's real. Y'all have some real heat down here. But soccer players are very in tune with their bodies. I say that as a positive thing, because when we look at, as Joe and I work sometimes with the American football players, man, we're going to run through, we got our helmets on and our pads and all this gear on, and we're going to run through the wall.